Hello friends, today in this video talking about Parkinson's disease, which is a neurodegenerative disorder and it is one of the most common neurological disorder that's seen in older adult. Knowing about Parkinson's disease is very important in our upcoming exams as well as in the clinical practice. In this video, you can see the signs and symptoms, treatment, nursing interventions with some study tricks and mnemonics to learn it. So try to watch the full video. Okay, let's start. Parkinson's disease. It is a neuro disorder that affecting the movement. Whenever you study about Parkinson's disease, remember that it is a movement disorder. So the signs and symptoms are deals with the movement. Let us see why it is happening here. The dopaminergic neuron is dye that are located in the substantia nigra. You know, the substantia nigra is a part of basal ganglia and which is the part of midbrain that control the motor movements. And remember one more thing, that normally there is a balance between the neurotransmitters, that acetylcholine and dopamine. Acetylcholine is an excitatory neurotransmitter while the dopamine is an inhibitory one. Therefore, they are always balancing each other. With the decrease of dopamine, there is more acetylcholine that leads to increase in cholinergic activity. Acetylcholine is an excitatory neurotransmitter, so there will be an overstimulation of the neurons that cause signs and symptoms like tremors, rigidity, etc. In Parkinson's disease, the dopaminergic neuron, which is dye that are located in the substantia nigra. What do these dopaminergic neurons do? They release the neurotransmitter dopamine, which allow us to have accuracy with the movement. Therefore, when these neurons die, there is less dopamine available to stimulate the neuron, and this leads to abnormal movement. The exact cause of this Parkinson's disease is unknown. Etiology we can be remembered with a word PAR. PAR, that are P is for primary neuronal degeneration. In 75%, Parkinson's disease is caused by the neuronal degeneration. A stands for anti-dopaminergic drugs, and after encephalitis. After encephalitis and use of an anti-dopaminergic drugs can lead to the signs and symptoms of Parkinson's disease. And R stands for rare causes. The rare causes are Wilson's disease and some toxins. Then let us discuss the signs and symptoms of the Parkinson's disease. The most common is tremor that is at rest. The tremor can be seen at hands, arms, legs, lips and tongue. When the patient experiences tremor at the fingers and hand, then we will call it as pin rolling. What it mean by pin rolling? It is look like just the patient is rolling the pill in between the fingers, and it is a peculiar characteristic symptom that is seen in Parkinson's disease. Always remember the word pill rolling that we can expect in our exams. One thing to remember about the tremor, that is attempt to improve with the purposeful movement and it worsen with resting. And other clinical presentations are stiffness on extremity, akinesia. Akinesia means absence of movement, shuffling of gait, that is forward bending, bradykinesia, that is decreased movement, swallowing issues like drooling, not able to chew and swallow, mask-like face, then slurred speech, coordination problem, anosmia, constipation, depression are the other symptoms that are seen in this patient. So the clinical presentations that we can be learn with the word Parkinsonism. Okay. The code to study the clinical features also the Parkinsonism. So it is easy to remember. So let us see one by one. P for pin rolling movement. A for akinesia. R, rigidity. K resembles with C, so cogwheel rigidity. I, impaired thermoregulation. S. Stare or slurred speech. I. Issues with the swallowing. And again is shuffling gait. And the last M is for mask-like face. These are the clinical features. Now let's see what are the nursing management of a patient with Parkinsonism. Safety. Safety of the patient is an important factor because the patient is having coordination problem, kinesia, bradykinesia and all. So we have to provide assistance to the patient and assistive devices like wheelchair or walker that can be given. And balance is a main problem, so advise to move slowly, advise the patient to move slowly, and can provide low heel shoes, rubber canes with a single point. Bathing. For safety and comfort, use the shower if possible. Tub bath can be falling hazard. Let him dress himself as much as possible. Suggest that he sit down and dress on the side most affected side first. And provide a shirt or dresses without button or zipper because the patient is having a tremor. Patient may have trouble in swallowing. Fix moist, soft foods. Avoid food that crumble easy like crackers. Thick drinks like protein shakes are also easy to swallow. If eating is tiring, fix smaller meals more often. Easy to chew food that we can be given, and the food should be rich in high fiber because the patient is having constipation, indigestion problems. Advise the patient to take 2 liters of water per day. Serve fiber rich diet like whole grains, cereals, fruits, vegetables to prevent constipation. Serve a calcium rich food 3 times a day to prevent osteoporosis. Dairy food like cheeses, vitamin D, fortified milk, and yogurt are good choices. The Parkinson drug levodopa is absorbed best in an empty stomach, so give levodopa in empty stomach. Exercise. Parkinson's disease affects the patient's ability to move, but the exercise can help to keep the muscles strong and improve the flexibility and mobility. Encourage the patient to exercise with facial muscles, jaw, and mouth. Therefore, sing or read loud using big lip movement can be suggested. Now we are seeing what are the medications that we are given for this Parkinson to relieve this Parkinson symptoms. Levodopa. It crosses the blood-brain barrier and is converted into dopamine. When combined with carbidopa, enzyme dopa decarboxylase is inhibited from metabolizing levodopa, leading to a higher level of dopamine that can cross the barrier. Protein can decrease the absorption of levodopa, so serve protein at dinner. Anticholinergic agents. They are synthetic drugs which have been developed to achieve a greater affinity for cholinergic receptor site in the central nervous system. This drug inhibits the effect of acetylcholine at receptor site of substantia nigra and corpus striatum. Peripheral anticholinergics reduce drooling and other secondary effect of Parkinsonism. Then amantadine. Amantadine is an antiviral drug that increases the release of dopamine. That is used to treat dyskinesia in Parkinson's patient who is receiving levodopa, as well as the extrapyramidal side effect of these medications. Another drug is MAOB inhibitors, monoamine oxidase binding inhibitors. It reduces the motor fluctuations seen in many people with the Parkinson's disease. People treated with carbidopa levodopa are often experience fluctuating symptoms of Parkinson's disease and are described as on and off episodes. The on episodes are experienced when the medication is working and the symptoms are minimal, and the off episodes are when the medication is not taking and the wearing of symptoms are worsened. MAOB play an important role in the breakdown of neurotransmitters like dopamine. MAO inhibitors block the action of these enzymes. Adding an MAOB inhibitor slows down the breakdown of levodopa and dopamine in the brain and may boost the effect of levodopa. Another drug is COMT inhibitors. COMT is an enzyme that metabolizes or degrades the neurotransmitters such as dopamine. COMT inhibitors block the action of COMT enzymes. Tocapone and entacapone are the two COMT inhibitors that are used to treat Parkinson's disease. Another drug is dopamine agonist. Dopamine agonists mimic the effect of dopamine by binding to the dopamine receptors. Dopamine agonists are less potent than the levodopa but are useful in treating Parkinson's disease because they can overcome the levodopa induced side effects like dyskinesia, that are the involuntary movement of the arms, legs, and other body parts. When the dopamine agonist does lowered or stopped, some patients experience symptoms of withdrawal such as anxiety, pain, depression, and suicidal tendencies. Therefore, caution is necessary during the use as well as the discontinuation of the dopamine agonist. These are about Parkinson's disease. Remember the following terms. They are substantia nigra, the location, pin rolling movement, cogwheel rigidity, akinesia, bradykinesia, and therapeutic diet of Parkinson's disease. These are the important points that we have to remember regarding this disorder. So again we can see with another video. Till that, bye. Thank you.